Hello to everybody who's in the Zoom room. It's great to see some familiar names in the crowd. So grateful to the CHC team for bringing us together and for making space for these important conversations. Today, I apologize. The event was advertised as having me speaking alongside Samantha Gualtieri from our team, who's unfortunately been unwell this week. So you get just me, but I will try to make sure that I honor all of the information that Sam would have brought to the conversation today as well, and I'll take back questions as well if anything comes up that would be within her purview. Yeah, we're going to be talking about a project that is near and dear to my heart that I helped found just over 3 years ago called the Our Kids Health Network. We'll be talking about some of our lessons learned in developing and delivering culturally adapted information that's evidence-based and accessible using social media platforms and trying to reach out to equity-deserving communities. Without further ado, I'd like to start by acknowledging the land on which we're meeting, although virtually today. For thousands of years, it has been the traditional land of thriving, diverse, and rich Indigenous communities who have acted as the original custodians of these spaces. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. I think it's important for us to remember that this comes with a responsibility for each of us and our institutions to commit to learning about the exploitation, enslavement, colonization, genocide, and marginalization of Indigenous communities and how it's contributed to the systems in which we participate now, and many of us continue to benefit from today, even if unintentionally. I also understand that the practice of land acknowledgement is only a very small step in the long journey towards true and meaningful reconciliation, which will require us to work together in respectful collaboration to dismantle and rebuild these systems. I'm joining you from Treaty 19 territory just outside Toronto, and I'll pause for each of you to think about the space that you're in today, its history, its legacy, and your relationship with that land. And while you're reflecting on that, I'll just highlight this illustration here called Family Love. It's by an artist named Simone McLeod. If you're interested in supporting or purchasing her work, it's available on Etsy. Also, if you're not sure where you're located or the history of the land where you are today, there's a really great website called native-land.ca, which is like an interactive Google Maps style site, which allows you to zoom in on kind of treaty histories, Indigenous peoples that have inhabited the land, prior linguistic history as well of the different spaces. And it's really neat how they've put that together with a global lens. So you can look at that for different parts of the world in addition to where you are today. I also want to acknowledge the artwork that I'll be sharing today and the photos that I'll be sharing. So the photos, many of the photos that you'll see in the slides ahead are photos that we've created as a part of our project. They're not stock images. It's really hard to find stock images of diverse families just doing day-to-day things. And so Paul Bossi was the photographer who took most of those photos. And then also the art that you'll see in our logos and in the motifs shared in some of our work have been created by artists from across diverse cultural linguistic communities who represent some of the communities that we work with. I'll get more into that. And also important to recognize some of the funding that's allowed us to create Our Kids Health, including the McLean Family Foundation, the Public Health Agency of Canada, through the Mental Health Promotion Innovation Fund, and the Department of Pediatrics at St. Michael's Hospital, which is where I work. And we've also had the opportunity to work in collaboration in creating this scale up of this work, which I'll be talking about, with engagement through the Canadian Pediatric Society, the Digital Health and Innovation Branch of the World Health Organization, and with Meta. And so a little bit about me. So I'm a developmental pediatrician in terms of my clinical training, and I work at Unity Health Toronto in the downtown East Core of Toronto, and the founder of this project called the Our Kids Health Network. And a lot of my clinical work is working with families who have concerns around their children's developmental, behavioral, or mental health, but often are experiencing marginalization in diverse ways relating to different aspects of their identities, including experiences with poverty, racialization, migration, and others as well. And I think in terms of what I'm bringing of myself into this conversation today, I think it's important to acknowledge that as well. In addition to my professional self, I think it's important for all of us to recognize as we think about equity work, our positionality as well. So I do want to say out loud that my work and my advocacy work in particular is impacted by my experiences as someone who's a healthcare provider and a consumer, a cis male, a settler, a person of color. I'm a parent as well of a precocious 12-year-old son. I'm a person with a Canadian post-secondary education in healthcare. I'm a person who is stably housed and employed. And I'm a family member of individuals who have chronic health issues and mental health diagnoses, developmental disorders, and individuals who are refugees and internally displaced peoples. Again, I'll pause for a sec for you to think about yourself and what you bring into your work, and also into the conversation today, in the different axes of yourself and your experiences that you've had. And so my hope is over the next kind of 40 minutes or so, to talk a little bit about the impact of health misinformation and disinformation in online spaces and its differential impact on communities that are already considered to be marginalized. To talk a little bit about some concepts in media literacy that's guided our journey. And I'll be using the Our Kids Health story as a part of, as a model for some of what we've been working on as a part of it, an example. And then also give you some actionable points as we think about online misinformation for the patient or client families that you're interacting with as well. As a part of that, what I'm going to tell you as we cut to the chase and not build up suspense is really that, historical methods of sharing child health information are inequitable. Diverse cultural linguistic communities have their own unique strengths and knowledge and values and perspectives and health information priorities, and they need to be honored and respected. And also that if we want to impact health behavior change and empower marginalized communities, it requires us to really reimagine and rethink how we share child health information into digital spaces, which we know is a place where a lot of families are turning for health information to guide their parenting journeys and their navigational journeys in healthcare. And so, often we'll hear in our clinics, our wards, our agencies, things like this. And I've heard many of these in my clinic. I read about this gluten-free diet online. ... Or I'm in a parents' Facebook group around children, for children with autism spectrum disorder, and I've been hearing more and more about stem cell transplants. Or I didn't have time to read that website that you gave me last time, or the website that you did give me. My wife didn't understand what it was saying about ADHD, or it might be around complementary, traditional, or alternative treatments as well. Like, what about using ginger and turmeric to treat such and such disorder? So, there's lots of the families that we interact with are looking for information online to help guide them. And there's lots of different places that they're turning, and the trustworthiness and the credibility can vary, as we are probably experiencing in our day-to-day sort of work. And some of the hard truths about this really are, in terms of the context for our conversation today, that there's important differences in how communities participate in the healthcare system. So this became very clear during the pandemic, and which is why we're all here today. But I would just want to extend that a bit further. There's differences in how families access care, but also how they access information, which helps them decide how they participate in the healthcare system as well. I think it's also important to recognize again that online health misinformation is rampant. It lives in every language and every platform, but evidence-based and accessible information is not as available. And here's a couple of examples here of Punjabi and Chinese homeopathic and traditional treatments for autism and ADHD being shared, which wouldn't be something that we'd be recommending from the same sort of evidence base that we would typically use in our clinical settings. And also that many BIPOC communities have a mistrust of healthcare institutions, which does relate to communal and painful histories of things, like I mentioned earlier, around colonization, exploitation, enslavement, medical experimentation, not so long ago, and including in many of our institutions that we work in now, and ongoing marginalization. And the vast majority of online child health information for families does tend to be Eurocentric in terms of how healthcare is viewed, how health and wellness is viewed, how disability is viewed, and is available usually in English, some French, and then there are some auto-translated websites as well. But a lot of families tell us that the fidelity of that translation, whether it's through Google Translate or others, is not as accessible to them and does require still a high level of literacy, even in that other language as well. We also know, these are numbers from 2022, that adults spend, and this is global, an average of nearly 2.5 hours a day on social media. And I'll pause for a second again for you to think about where you sit in terms of your social media usage per day compared to the 2.5 hours. But 2/3 of caregivers look for parenting information online. Half find information that's helpful, and more than half don't review the accuracy of what they find online based on, this was an American study. And so when we're talking about equity, and I'm glad that we are, I think it's important also for us to think about how does that translate into online spaces, which is where a lot of our families are spending time. And so there is this concept of digital health equity as well. And the WHO has a global strategy on digital health that they're working through. And they describe digital health equity as being a condition in which all individuals and communities have the information technology capacity needed for full participation in society. And so, they're talking about access being relevant and responsive in terms of having access to high-speed internet, having access to devices. But I think it's important for us also to think about having access to information that is relevant and responsive as well. So it's not just, being able to get onto the internet, but what is it that they're actually finding there? And when we think about knowledge, and sharing information, it's important to also think about, who creates that information and who transmits that information. And so some of you in the past may have seen a diagram like this. I think it's often called a power flower, which is a way of illustrating aspects of intersectionality, which were initially coined by Kimberly Crenshaw. And so the power flower here, in short, is trying to illustrate kind of different axes of identity and the value or centeredness or marginalization that has historically been tied to that aspect of identity. And historically, power, privilege, and position has sat kind of closer to the center of that flower, whereas folks with aspects of their identity that were kind of more marginalized or farther out from that center, were further away or had a harder time in terms of power, privilege, and position. And so when we think about who has created health information historically, who has decided which information gets created, it's often funders, healthcare institutions, governments, people again who historically have sat closer to the center of that flower. And what we've been really trying to think about is how do we democratize this? How do we change that power differential so that knowledge in this way can be brought more broadly to families? So when we're thinking about evidence-based information, the battling of misinformation, the latest and greatest in terms of what's being studied and shared. So when papers get published, they're usually in English and they're usually in a very high level of language that's being used that's not accessible. And it takes a long time before that gets translated to communities that have historically been marginalized. And so that's really some of what we've been thinking about in terms of the work that we've been doing through our kids' health. And also just reflecting on how this works to really otherwise widen inequity unless we act to change it. And so why does it matter in terms of, parenting and parent information? We know that the decisions that parents make, and I'm assuming folks in the room are already believing in this, but that the decisions that parents make are health behaviors. So deciding whether or not to complete your course of antibiotics, deciding whether or not to go in for your well child visit or to go to a speech therapy session, to structure what meal times can look like, what sleep times and bedtime is going to look like. These are parenting behaviors, but they have health outcomes related to them, both directly and also indirectly as well. And I'm going to pause for a sec again, just to ask for folks in the room, if you could type into the chat, when you're referring families to information online, where do you refer them? Maybe what are your kind of go-to websites or online resources where you're sharing, where you're sending them. And a part B to that is also, what are factors that you consider when you're referring families to specific resources? So where are you referring them and what are you thinking about? Or what is it that makes a good resource that you're referring families to? And that could be in your day-to-day work, or it might be from an institutional sort of standpoint as well. Thanks, folks, for typing into the chat. So caring for kids through CPS, about kids' health, yes. HealthLink BC, thank you, Tessa. Those are kind of my go-tos as well. I also think about Kelty Mental Health. And you're saying also that you aim for something that's evidence-based, but also easy to understand and has videos. Awesome. Yeah, so something that's multimedia. Great. Yeah, and those are the ones that I think a lot of people think about in terms of practitioners. Thanks, Priscilla, about kids' health. The ONT SPORE unit as well for patient engagement resources. Wonderful. Thanks. I'll just give it 5 seconds for it in case anybody else is typing something in and wants to press enter. But yeah, I think some of those considerations are important, right? Thinking about something that is evidence-based, but also balanced with something that's digestible and easy to access as well. And really important to think about that as we think about, again, yeah, families are online looking for information and what's something that we can give them that helps them in that journey, understanding that information that families access can save lives. It can save brains when we think from a developmental standpoint as well, families in terms of mental health and well-being, and also communities. We know that families that are able to do well from a health and developmental and mental health standpoint have better economic health as well. And when we think about cycles of intergenerational poverty, having access to improved health and well-being can lift entire communities out of poverty as well. So really important to think about some of the different equity dimensions here. And thanks, Priscilla. I see your comment there about evidence-based and language-appropriate factors as well. Thank you. So when we think about the idea of media literacy and this whole space around misinformation, this is a lot of information. So I'm going to kind of go through it in just a couple of bite-sized pieces, and then talk a little bit more specifically about our work. But so media literacy is described as the ability to critically, effectively, and responsibly access, use, and understand and engage with media of different kinds. And so including social media, including online kind of web resources as well. So thinking about being able to do that critical appraisal piece. Misinformation, a term we hear a lot, refers to false information that exists, but isn't necessarily intended to cause harm. Disinformation refers to false information that's intended to manipulate or to cause damage or harm as well. So a little bit of a difference there. And then we sometimes use this term infodemic. And so, this is a new term that's been used in recent years, but really the idea, again, that we're in a space where there's just so much information, including false or misleading information in a specific time space, where in particular, kind of in a specific disease outbreak, as we've been seeing with COVID. So this can cause confusion and risk-taking behaviors and can harm health. It also leads to mistrust in health authorities and undermines public health responses. So that may sound familiar to you. And so, conventional approaches to addressing misinformation have included, and certainly we saw this, kind of value judgments related to people who have vulnerability to misinformation. So, vulnerability to misinformation can be framed as being a personal weakness. It can be seen as laziness, mental illness or susceptibility, and also similarly, resilience efforts are framed from a perspective of individual information consumers rather than looking at system levels. And so when we're seeing that there is misinformation that's really rampant, Rather than blaming individuals, I think it's really important to think about the larger system as well, right? And I think I really like this quotation, which causes me to think often and come into a situation with empathy and humility, that it's not really people who fail, it's systems that fail. It's not people who fail, it's systems that fail. So pausing to think about that in the space of misinformation, when there are trends happening around, the role of bleach or ivermectin or something in terms of fighting infection, what is the systemic sort of approach or systemic approach that we can use to address that rather than causing people to feel ashamed or blamed for believing a specific thing as well. And so, we're in a space right now where we're all experiencing information overload. This has been happening, I would say, for me for a couple of years now, with so much happening regularly with COVID. But then, I think there's a lot of fatigue related to that as well within professional communities and certainly within individual communities as well. Also, we know that having too much information can lead to less than desirable outcomes, especially if people lack media literacy skills. And there is a lot of data, of course, that shows that if people regularly visit more than one information source, it allows them to triangulate to be better informed as well. So it's helpful for us as leaders in these areas or as practitioners to have a few different sources up our sleeve that we can share with individuals and families. And that there's a positive relationship between levels of institutional trust and the institution, let's say, of like healthcare or education, and information-seeking habits as well. And as we know, and you may have experienced it either as a possibly as a healthcare consumer yourself, that people are often inclined to search online for symptoms and find health information online. And the role of the healthcare provider now has shifted to be almost like a fact checker. It's like, oh, I looked online, I think I might have strep throat. What do you think? As opposed to coming in, as may have been done a decade or two ago, with more of a blank slate or an open conversation. So, relationships are really key there, building trust and being open to hearing what families have to say when they come into these conversations, because they often have something already in mind they want to talk about. I'm just going to zoom forward a little bit. Also remind us that a constructive and empathetic discussion is really key. And also recognizing that you have to pick your battles a little bit. Misinformation it comes in different sorts. So some misinformation may be more immediately dangerous, while others, may not. And I think it's helpful to think about how your relationship with your kind of the person in front of you or the community that you're working with may be impacted by how you navigate that as well. So again, prioritizing the conversations you want to have and which misinformation you want to debunk. Also, just wanted to mention that as we're talking about the use of social media and in health information, there is a greater international focus on this space. So the WHO and the National Academy of Medicine created this document last year, and our team was pleased to be able to contribute to it, around global principles for identifying credible sources of health information on social media. I can share a link afterwards if that's helpful for folks who want to take a look at it in terms of, what are some of those criteria that would help us figure out what is a credible source. And then likewise, there was a virtual roundtable meeting last fall with the WHO and the BMJ. And again, we were pleased to contribute to this around creating mental health content for young people online, and how do we make sure that it's developmentally appropriate and also culturally responsive as well. So there's a lot of international focus now on online resources and information, again recognizing that that's where people are looking. I'm going to share a quick video, and I'm going to take a sip of water in the meantime as we talk a little bit about our work then in creating the Our Kids Health Network and trying to work in this space and trying to leverage social media for good with our families. So I'm going to play this just for a couple of minutes here. I hope sound works.
How do I talk to my teen about her anxiety? Can I trust vaccines? How much should my baby be eating? How do I talk to my child about distressing events? Parents and caregivers have infinite questions as they raise their children, and most families are searching online for information to help them answer these questions. However, reliable, relevant health information online and on social media can be very hard to find, hard to understand, and can be false and even harmful. This can leave families feeling unsure and in danger. With all that in mind, Dr. Ripudaman Singh Minhas, a developmental pediatrician at St. Michael's Hospital, began to make evidence-based bilingual digital content for the Punjabi community during the pandemic. And from there, the spark for Our Kids Health Network was lit.
As a Punjabi Canadian myself, growing up, I never really saw my family's health priorities reflected in the content that was available or even in how healthcare providers were sharing content with my parents as they were making decisions for our family. They were always having to think about, how does this apply to our cultural context?
In only 2 years, that one channel turned into 10 evidence-based cultural linguistic health promotion platforms on social media. Filipino Kids Health, Tamil Kids Health, Hispanic Kids Health, Black Kids Health, Ukrainian Kids Health, Inuit Kids Health, Arabic Kids Health, Mandarin Kids Health, and Cantonese Kids Health, together making the Our Kids Health Network.
Oh, there's a YouTube ad. I apologize. We'll give it 1 second. I was hoping this would not happen. I'm not affiliated with Falls View Casino. In a world where information can save lives, most existing health information online is in English, requires a high level of literacy, and tends to be Eurocentric in nature. This struggle is even greater for families who are Black, Indigenous, or people of color, and often come with painful histories of colonization, enslavement, genocide, medical experimentation, and marginalization in different ways. So the Our Kids Health Network is a health promotion program online that uses social media to bring reliable, relatable, evidence-based health information to families across a range of different cultural linguistic groups.
At Our Kids Health, our team works hard to ensure that each piece of information is peer-reviewed, adapted, and made accessible through easy-to-read infographics and digestible reels, all while ensuring accessibility and accurate representation in all of our content. So how do we achieve all of this? 1. Research coordinators. Through the tireless work of our team of research coordinators, who not only represent the cultural linguistic community of their platforms they manage, they also use their social media knowledge and training in evidence-based research to ensure the high quality of content and efficacy of the research we do.
Every time I meet a provider that's from the Hispanic Latino community, they're like, oh my God, this is so needed. I wish we had this when I was younger. Lots of enthusiasm from people who want to be part of this.
If we're giving a live talking to parents and caregivers in the Caribbean about how to introduce solid foods, Caribbean solid foods to their babies, having parents from the Caribbean being at that live, asking questions about the kinds of spices that they use, what's appropriate, has been very surprising. Surprising because it teaches me that the community wants this information.
2. Our healthcare providers. Each of our platforms feature healthcare practitioners who identify with the cultural linguistic communities our channels serve. This ensures that our providers not only give expert healthcare advice, but can also address the culturally specific needs of their respective communities.
In our community, still a lot of mental health stigma. In this channel, we're able to provide reliable knowledge about what is ADHD, the symptom looks like, if your child is struggling with stress and how it looks like.
When I was considering my career in family medicine, I didn't know any Black doctors. I didn't really have that role model that was definitely someone I could go to and emulate when I was trying to develop my career. So I'm very, very mindful of trying to do that with, my patients, with kids I meet. Oftentimes when I'm running into a child of color, I'm like, what do you want to do when you grow up? Have you thought about this? Have you thought about that? Let them know that there's no limitations and that they can really do whatever they want. Is there an apple in there?
Nope.
Some eggs?
No.
Oh, I gotta go back to med school.
3. Our online community. The Our Kids Health Network has made notable achievements, including a collective following of over 500,000 followers, over 40 million views across all platforms, and a new member joining one of our digital channels every 24 seconds. Our Kids Health has proven to be a vital resource for people across high priority communities.
Having a platform
I'll just pause there and then switch back to our other screen. Thanks for your patience with that, but I felt like the video kind of describes our journey a little bit better than I could with a bazillion slides. But really, in terms of what we've been doing with our Kids Health, which started again with the Punjabi Kids Health pilot chapter, and now has scaled up to these 10 cultural linguistic chapters, and the numbers there were a little bit dated, so we're now at more than 800,000 people following our platform, which is really exciting. We really want to make sure that content is evidence-based, and is culturally representative and inclusive. And there's a lot of adaptation then that happens in terms of our team members doing that work that embraces and really leverages the power of families and communities, and shares information that matters to communities as well. So, the different chapters have some core content that is shared across all of the communities, whereas there may be other things that are more specific to the experience of Black communities or Ukrainian communities, which then is where I think some of the magic happens, where we're able to share things that are specifically relevant and are being overlooked in terms of other health information platforms. So it's not just a language piece, but the idea of what's relevant in terms of the living reality of different communities as well. And we want to make sure that we're supporting families in making the decisions that are right for them, but making sure, again, that they have the information that they need. How we've been doing this, we get asked a lot about kind of the structure behind it. And so we've been usually sticking to the idea of having a weekly topic. So it may be nutrition or developmental health. And then with that, we'll have 2 or 3 TikTok style videos or reels, and then infographics as well. And so we like the idea of being able to share information in infographic format, where some families are telling us that's much more shareable for them. It works well for families that may have limited data access as well compared to a video. And then the videos have their own merits where, they're often engaging. Sometimes they're with fun music with the practitioner pointing. Sometimes it's with a practitioner speaking. And we try to make sure, again, that they're engaging and accessible. And then also making sure we observe and raise awareness around hot topics or special days, and particularly if there's a breaking news sort of a topic that might be relevant as well. And we have a focus on trying to make sure, or making sure that people on screen are regulated health professionals who are credible, but across different professions. So we have physicians, we have nurses, dietitians, OTs, PTs, ECEs, people with psychology and psychotherapy backgrounds as well. So it's great then to be able to create a space where expertise within these communities can have a space also. And so our professionals on the channels really enjoy being able to volunteer their time. And here's some examples of some of the topics we've covered in the past. So vaccines, breastfeeding, positive affirmations often tend to do well, just like a quick one-liner of some positivity within someone's feed. Mental health in its different forms is really often a big hit. So caregiver and well-being, caregiver and parent well-being and mental health, but then also things around youth mental health, and then also developmental behavioral mental health for younger kids as well. And then there's a post there also around speech milestones. And then likewise, a few other things here in terms of different topics around diet. We were, one of the things we were a bit surprised by in terms of our journey is, we didn't realize that, one of the other things that we're actually really able to do in using social media is be very agile and responsive. So the green post there that you see is, 5 supportive things you can say to your child if they see distressing events in the news. It's troubling, but we've had to repurpose this many times across different channels over the past year. It kind of speaks to the fact that, again, if there's something distressing in the news, people are taking in information on it online, almost live. And so we've been able to act quite quickly to be able to create posts. So if something happens that is specific to Black communities, that is very prominent in the news, then to be able to post something quickly on that channel for families where they may be struggling with, how do I talk to my child about this murder that is being widely publicized, or about, unrest that's happening in our country of origin, and how do I discuss this, with my kids, or help them navigate what they're seeing on the media as well. And then likewise, last year, when we were having those awful wildfires in different parts of North America, we were able to also create content within a couple of hours and post about, what does an air quality advisory mean in the different languages, but then also with the representation on screen as well, so we could act in an agile and quick sort of way as well. And as I was saying, the numbers have been growing very quickly. And what started as a local phenomenon has grown quickly to be a bit of more of a global phenomenon or movement. But we're coming up to expecting probably about 1 million members or followers soon. And here's some quotes from some of the families that follow our platform. So one of the families that follows our Filipino channel was saying, having easily accessible and reliable information guides me in making decisions about my family's health. I ask for advice from parents or friends, but at the end of the day, I decide for my own family. So it's nice to know that we're able to support around that agency and the decisions that a parent is making. From the Ukrainian Kids Health channel. Thank you for raising information about this important topic. So I think this was related to our post about autism spectrum disorder. So especially now and in the future, society in Ukraine will need more and more information about disability and attitudes of society members towards it. And then here's another one about the positivity that you share always reminds me of the responsibility and how rewarding it is to be a parent. Being encouraged to seek help and knowing that there are alternative solutions really enlightens my emotions and brings me hope in my parenting journey. It's really powerful to hear that. And from the Hispanic channel, excellent information for parents and even teachers. So this person was saying, I'm a teacher and a grandma, and I try to inform myself so I can better support my grandson. And again, that I think is a nice reminder for us about the importance of sharing information for families that may have diversity in caregiving structures or healthcare decision-making behaviors as well, understanding that in many communities, grandparents play a very important role in caring for children and helping to make decisions for their health and well-being. And that's been something that parents have been telling us. So for example, someone like myself, even though I'm English speaking, I may take in English content from the Punjabi channel, but then I might then share the Punjabi content with my parents or in-laws. So it's easy for them to take that in and for us to be on the same page as well. So that was something, again, we hadn't initially expected when we created this, but has been a nice thing to hear from families that follow our work. As a part of our work in misinformation, so we've been thinking a lot about also, what we've seen as a really ample proof of concept around this, what they call a trusted messenger model. So, you've been seeing that on our different platforms. We have practitioners on screen who reflect the diversity of their community, and we're hearing from families that helps to improve trust and rapport and uptake of that information. And so what we created over the last 6 months was a corollary that focuses on youth experiences as well. So we created the Our Kids Health Digital Health Youth Fellowship Program. So these youth between 15 and 24 who identify with our 10 different chapters had applied and interviewed with us, and they've been going through 6 months of online training with different webinars and small group sessions, learning how to battle misinformation, how to critically appraise health information when they see it, how to engage online, and how to essentially become, a health content creator for their peers within their community. And many of them had shared with us their own experiences in confronting mental illness, chronic physical illness or disability as well. And so we're really excited to be able to help them in owning their voice, giving them the tools that they need to also go out there and share that positivity, to share hope with their peers, and also battle misinformation as well. So we'll be having their graduation actually coming up in a couple of weeks for this first cohort, and we're excited to see where they take this. Some of them may actually be appearing on our channel, so stay tuned for that. But it's been really interesting to hear from the youth themselves about what are topics of interest that they would like to tackle. And, we're hearing really resoundingly, you'd like more reliable and helpful information on mental health and well-being and coping with adversity, content on celebrating cultural identity and the importance of that, gender diversity, cultural foods and practices, and also the importance of and strategies for maintaining intergenerational ties as well. So it's really interesting to hear again from these diverse youth leaders around what's important for them as they think about their journeys in becoming health content creators as well. And so I'll wrap up in just a moment, but just thinking about again, so taking a step back in terms of when we're recommending online resources to clients and families or users of our services, I think, here's a few tips to keep in mind. So thinking about, not assuming what is accessible to your patient or where they're going to be looking for information, but asking, are there preferences for what platforms they use or what sorts of online spaces they're in? Do they have a preference for video information versus written or infographic information? And then cultural linguistic preferences. And would they prefer a summary or would they really like, a 7-page handout on constipation or whatever it might be? Families have different things that they'd like to know. And so sometimes, many families are, let's cut to the chase and just tell me what I need to know. So I think that's really interesting. Also keeping in mind with that, what is their level of literacy? So generally with OKH, we try to keep everything to a maximum of grade 6 level of literacy so that it's accessible for families, but also something to consider in terms of the communities that you're working with as well. Trying to keep it evidence-based, so make sure that resources are vetted before you share them. Also understanding if there are complementary or alternative medicine preferences within the community, and are those things that need to be addressed, or are there resources that might help them in terms of that aspect of their decision making, and then also having a repository then of some of the topics that are important to you, which were mentioned in the chat earlier by some of the folks in the room. And then also staying connected. So, they sometimes call this social listening, the idea of understanding, what's out there in social media spaces, what disinformation is out there, following your communities online, and being an active and open listener. And from our journey, that's been really important. So I think we initially started with the idea of being an Instagram presence. We quickly learned that some of our communities and some subsegments of some of the communities that we work with, are very, very active on Facebook or on more community-specific platforms. So we've started to have a presence on Telegram, which is where a lot of families displaced by the Ukraine war were seeking information. And then for East Asian platforms like WeChat and Xiaohongshu as well. So following the lead of where your communities are, if you're creating information or sharing information as well. And if you're interested in creating digital health resources and want to kind of foray in front of the ring light and the camera, again, similar sorts of tips for you. So if you want to create information, make sure it's evidence-based, share actionable points. So less theory, we find generally. A lot of people, again, are kind of, what are the things I need to know? If you're doing myth busting, be respectful, focus on the truth and not the myth. And think about, again, accessibility. We find generally short videos tend to do better than longer videos. So even if we do have an Instagram live that's 45 minutes or a longer YouTube style video, we find that the shorter clips of it tend to do better. And we kind of think as we're creating content, if I were a busy parent in line at the grocery store who's flipping through my phone, could we create something that would just give them a little microdose of something positive and something helpful in terms of their parenting journey? And then also understanding, number 3 there is, what is the experience of that community? And so making sure that you keep in mind principles of being trauma-informed and culturally and linguistically adapted. We've found that representation on screen really makes a big difference in establishing rapport and trust. And then also understanding that there are subpopulations. So, thinking of communities not as monoliths. So, when we think about some of our chapters like Black Kids Health, trying to create content for Black communities, it's such a vast space. And so we hope, if funding allows in the years ahead, to create kind of more branches or kind of sub chapters from there. And likewise for Arabic Kids Health or some of our other chapters as well. But understanding that needs may be different if a community is a newcomer community, if they are previously resettled, or what their linguistic sort of preferences and dialects may be as well. And as I was saying, also understanding that multi-generational caregiving practices are really prominent and important in many communities as well. And if you're embarking on this journey and you'd like some help, do reach out to us as well. We're happy to help. We've had some partnerships recently where we've been able to help with creating or translating or adapting content. So if you have tools that you're creating that you'd like to help, you'd like help in reaching out more to equity deserving communities, we can help with aspects of that. Likewise, with community engagement. So I didn't mention earlier, but each of our chapters has its own community advisory board. So rather than being practitioner-led in terms of the content, we follow the lead of our communities online. So both in terms of the messages we get, but each of our community coordinators for the chapter then has assembled a community advisory board of agencies and community champions that focus on the health of that specific cultural linguistic community. If community engagement is something that's helpful, specific to some of these chapters, we're happy to help with that. And also in terms of training, if your team would like some help in your social media and knowledge mobilization journey, we've learned a lot along the way that we're happy to be able to share if a more formal training session would be helpful for you. So feel free to reach out. Again, I'm the one person that is here from our team that gets to come in and tell you all about this, but there's lots of people behind the scenes who help create the content and review it and kind of make this happen. And in particular, I'd like to thank our core team that does most of our behind the scenes work. So Sam, again, wasn't able to be here today, but especially our chapter coordinators or research coordinators who really have become community coordinators. They do the community engagement piece. And then they also do the content creation piece as well, working with our providers that are in front of the camera. And all of them bring really, vast experiences, both in terms of their scientific training backgrounds and also lived experiences where they're, each of the chapters has a coordinator who reflects the diversity of that community, and they bring their know-how and experiences to that as well, which, really adds to the richness of the work that we get to do. So thanks so much to all of them. And you'll notice that I'm on this this slide here with a team of otherwise all women. And I think it's a good time to also remind us that it's International Women's Day tomorrow. And it's really a pleasure to be able to work from and learn from this amazing team. And I put into the chat earlier, but I'll pop it in there one more time for if you'd like to follow our channels or follow our journey through our newsletter or reach out, then I'll share our information there. And if you want to reach out, feel free to reach out to me or to Sam again, who, she'll hopefully will be feeling better in the next day or two, but do feel free to reach out. I'll pause there and I welcome any questions that you might have.
Can I jump in with a question?
Absolutely.
Can you hear me okay? Yeah.
Yes.
Thanks so much for this. It was awesome. It's so exciting. I was wondering if you could just talk a little bit more about the advisory group that leads to the content identification. So I understand the person who, like the individual on your team who's actually developing or working on behind the scenes, developing the content is sort of leading that advisory group. Like just practically speaking, how often are they meeting? How are they getting input? Like, can you just speak to how that works?
Yeah, absolutely. I think that's a great question. And it's been a learning experience for us. It's different for different chapters. So I would say most, so for, I'm thinking they probably meet maybe quarterly or so with the coordinator. We love if we can get them all into one online space to be able to kind of riff off each other and kind of have some of that energy to be able to do it. So some of the coordinators and chapters have been able to do that. Oftentimes it ends up being more one-on-one where the coordinator from the team then connects with that agency and then kind of polls them around, what are different topics that might be of interest to the community? What do you think of how we've been doing so far? What can we do better? So we've been trying to make it accessible to different agencies and champions to be kind of a part of it. So it's a bit of a flexible sort of model. Ideally, we like to try to do it in a way where it's more of a formal community advisory board through a Zoom meeting, but understanding that that isn't how everybody works. Thanks, Tessa. Hi, Priscilla.
It's so great to see you. I loved the presentation. I have a question for you. In terms of your advisory, I was wondering if you could chat a little bit about the compensation model or models that you're utilizing in order to compensate them for their time in participating in the KM activities. And in addition to that, in terms of the advisors, how you're supporting them beyond the compensation piece with potentially additional trainings or professional development so they can be contributing to the co-creation of these KM products. I'm curious what that looks like in practice.
Yeah, it's been tricky. And maybe what I'll do is I'll stop sharing screen so I can there we go. So I can kind of see the Zoom room a bit. So help me if I miss part of the question as I try to answer. So in terms of the different people who are involved, so the community advisory boards, so I would say for the folks that are there as a part of an agency, they're usually not compensated, so they come as a part of their work. And so with that, we haven't been able to offer compensation. Likewise, we would like to be able to compensate our healthcare providers who are on screen. And in terms of the initial funding that we had, that was taken off by the funder, which I think was, I don't agree with, because, many of them are busy professionals. Many of them, have shared, their own experiences with marginalization, and the need for them to work and to be compensated appropriately for the work that they do. But we appreciate, the work they've been able to do so far in volunteering their time. The youth who are in our youth fellowship program do get a stipend for their time. And moving forward, we hope to be able to give them stipends for if they're helping to create content with us as well. And in terms of, you were asking about trainings, I think. Yeah, so I think, we share many of our learnings through our board meetings. And so often it's kind of sharing, here's what we learned kind of works well. And we also are pleased to work with, we've actually had some nice success with some of the community agency members who have backgrounds that lend themselves to being on screen. So we do trainings with them on how to create content as well. And often, they'll come on screen and share some of their expertise.
Okay, thanks so much.
Thanks, Priscilla. Tessa?
Okay, another question. So in the 10 channels that you have, obviously there's cultural and racial diversity represented. Has there been consideration or if not, like what's your thinking around representation of groups of the population, for example, like people with disabilities or people with chronic illness or a specific diagnosis? Just from a health perspective, like wondering, I work with medically complex kids and I would love to develop something like this, but to also just have that, represented on your channel as well would just be amazing, recognizing that it is a smaller portion of the population, so maybe not relevant to as many.
Yeah, no, that's such a great point, and something that we've been really reflecting on is, folks that are intersectionally marginalized, or kind of like you were saying, subsegments within marginalized communities. So that's really important to us as we've been thinking about next steps in that visual representation on screen. And so we're hoping in the months ahead to have another round of photo shoots and video shoots where we can have representation of diverse family structures, of diversity and physical abilities as well, and having families feel comfortable in coming out to be on screen. From a content standpoint, that's also something we've been exploring more of as well, is thinking about, we've been terming them hubs. So, we've got our social media presence, and then we have our website, which recently launched as well. And so on the website, we're hoping to kind of create clusters or hubs of specific content. So if it is specific to a specific diagnosis, then we could have, let's say, 5-10 videos and infographics that are specific to that. And so if there's specific ideas that come to mind, reach out to us. Happy to chat about what that could look like and how we might be able to collaborate around some of that. So, for example, if it was, I'm just going to throw out, there's something like Down syndrome or trisomy 21, then, what would that look like in terms of creating content specific to those communities? And we do get questions, as you'd imagine, from families, saying, thanks for that post on what autism is, but, can you tell me more about what ABA therapy is? Or can you tell me about how I plan for transition to adulthood? So again, we've started, I think, just to scratch the surface in this first year since our scale up, and really excited to see, how can we create more defined content? Because again, all of these families have the right to be able to access that information. And so how do we do it in a way that we get it out to them?
Is your funding, I forgot what you mentioned about funding. Is it sustainable? Is this, no?
Oh, I
So
wish.
you're
No.
constantly just fighting. Okay. Yeah.
Yeah. So the initial
Okay.
funding from Public Health Agency of Canada was for like a year pilot.
Yeah.
And then
Okay.
so thinking about
Of course.
next steps. Yeah, of course, right? Awesome. I welcome any other questions, or again, if folks want to email or follow up, welcome to keep the conversation going. And hopefully this has given you something to think about. And again, we welcome your feedback on if there are specific topics that you'd like to flesh out more, or if you'd like to chat about some of our learnings, that's welcome.